Dr. Staci. So Dr. Koo talked about how kind of predominantly it seems to be right now that men who have sex with men are the folks who are mostly becoming infected right now. So some of that is through sexual contact. Some of that is through things like close contact at parties, clubs, raves, festivals. Can you talk a little bit about what people can do to lower their chances of getting monkeypox through those kinds of activities?
Absolutely, absolutely. Yeah, so when I was talking before about touching the rash or touching any of those active lesions, that is the sort of thing that you need to try to avoid. And so being very open with potential sexual partners about any rashes or symptoms that you might be having. Sometimes the lesions are, like Dr. Koo said, sometimes there aren't many lesions, but the person is still very contagious. And so if there are lesions, it's best to just not have any sort of sexual contact and get that checked out. The other thing is, if somebody has those lesions, it can also be shared through those what we call fomites, the things that have been touched by those lesions, right? So bedding, towels, any sex toys or fetish gear or anything like that can actually spread monkeypox as well. So avoiding the skin-to-skin contact with people who have that rash. If you're going to be at something like a rave or a party, club, festival, anything like that, you need to be careful, because a lot of times people in those environments are warm and hot, and they're not wearing a whole lot of clothes, and a lot of skin is exposed. And so there could be a lot of potential for skin-to-skin contact and spreading of this. There have been some cases that have been known to be passed that way. And avoiding anonymous partners in things like saunas, bathhouses, sex clubs, sex parties, anything like that right now would probably be ideal, just in the setting of all of the spreading at this time. And then avoiding, especially, if you are doing any of these activities, being really careful about washing your hands, being really safe, not incubating sensitive areas of your own body.
Great, thanks. And just to follow on to that, pardon me, can using condoms reduce the risk of getting monkeypox during sex?
So it is thought that using a condom should be able to reduce if there's a rash there that it's covering, right? However, it's not a fail-safe method. So, I mean, that I'll be very pro condom use because there are a lot of other sexually transmitted diseases that can be spread with an anonymous partner. But with monkeypox, I think that it would be better than not. However, I don't know that it's going to keep you 100% safe.
Great, thank you. I'll put this one out there for either Dr. Koo or Dr. Staci. What should a person do if they think they've been exposed to someone who has monkeypox, or if they have a new or unexplained rash, sores, or other symptoms that might look like they could be monkeypox?
I was going to say ladies first, but ladies' choice.
Ladies' choice, okay. Well, so I think there are two things. I'm going to let Dr. Koo speak as well, but I think there are two things that you need to be thinking about if you develop a rash. I think you need to be thinking about how to take care of yourself, and I think you need to be thinking about how to take care of other people around you, okay? And so how to take care of yourself, I want you to try to get a hold of your doctor's clinic. I want you to tell them that you are noticing that you have a new rash and that you might be concerned that it could be monkeypox. Don't be afraid to say those words, because it'll allow you to be triaged to the most appropriate place, and they'll know to test you, right? So speak up about your concerns. And if you don't have a doctor, please give us a call at RiverStone. We'll be happy to see you over there. Okay, we have a whole viral care unit because of the COVID pandemic. So we are triaging all of our patients over there for testing. So take care of yourself, go in and get tested. The other thing that you should do is try to avoid being out in public other than going to the doctor's office as much as possible until you get your test results back. That will help to protect other people, and try to avoid any close skin-to-skin contact with others. And if you're isolating at home, that won't be possible. So just try to take it easy. Occasionally this rash is the first thing that shows up, but then a lot of times people will get fever, they'll get swollen lymph nodes, and they'll just kind of feel malaise and icky. And so just take really good care of yourself while you're waiting to find out the results. Do you have anything to add to that, Neil?
No, I think that this is one of those things that, as I kind of pointed out earlier about the stigma and the concern, if you feel like you're at risk and this may be monkeypox, tell your doctor that, because the worst thing you can do is to try to kind of make it very, very vague, and then you get misdiagnosed. And that's not good for two reasons. One is, if you really do have monkeypox, you're spreading it, potentially could be spreading to others. But two, then you're also delaying potential treatment if you're qualified for it. And as I pointed out, those lesions are pretty darn painful, especially in the nether region. So you don't want to miss those to get you don't want your doctor or provider to not make the right diagnosis. So that and that's what the doctors are listening for, is your risk factors. If you are exposed, you're exposed because of an anonymous sexual contact or someone you know that had monkeypox, and you develop that rash. You got to tell them, otherwise they're not going. They're probably not as likely to suspect that. Now, right now, most doctors are a little bit more keen because that's all on the news. But again, you want to let them know. Now, follow up that second question that you asked, Eric, about what do you do when you do get exposed? Well, one is don't panic, obviously, but that the virus takes about 5 to 13 days to incubate and manifest symptoms. So if you have just been in contact with someone, exposed to someone with monkeypox, the first thing you should do is really to kind of reach out to your the local public health, or for here in Yellowstone County is RiverStone Health, and ask if you could to get scheduled to get the smallpox, which is the same smallpox monkeypox vaccine, Genovius. And if you get it and you want that done as soon as possible, preferably within 4 days of an exposure. And that will help reduce your risk of developing monkeypox. Now, even if you are, for some reason, you decided to delay or you didn't know, and you past 4 days and you haven't had any symptoms, it is still worthwhile to get the vaccine. It may not be as effective in preventing monkeypox from developing, but it will help reduce the severity of the monkeypox symptoms. Oh, you're on mute.
Thanks. Jace, you've been waiting patiently there, and I know you are an expert in resources that are available to folks in the community. When people have monkeypox, the health department and their provider are going to recommend that they stay home for upwards of 2 to 4 weeks while their symptoms resolve and they, are no longer contagious. If I'm a person who had to quarantine for 2 weeks, but I worked in a place where I don't have any sick leave or money coming in during that time, what are some of the resources that are available that I could reach out to?
Well, definitely you want to check with your employer or their HR department to see if they have family medical leave available or some way to make sure you can maintain and keep your job, even if you're taking that time off and can't get paid. They might have some other resources available to help, like an internal funding process that can help with some of that. Also, if you're going to be without pay for 2 weeks, that's probably going to affect your rent, your utilities, and that kind of stuff. And we really reach out to HRDC, St. Vincent de Paul, Family Services, and take advantage of the resources they have there. They've really been good partners with us for help with utilities and rent. And I know right now HRDC has bouts of rental assistance, that are emergency rental assistance, or a rapid response for rental assistance where you need instant money. They can help as long as they've got the finances available. If you're working with the public health nurse because you've been named as a contact or have monkeypox, we'll be working with them also to help with those resources. So if you need something, definitely talk to your public health nurse and we'll try to find out resources we have in our community to help you get that taken care of.
Great, thank you, Jace. Another question has just come in. One, and I'll kind of split it up into two. The first is monkeypox in Montana? And I will just go ahead and say, yes, it is. We have had a small number of confirmed cases in Montana. If you're interested in knowing where cases are happening in the US, the CDC maintains a website with a map, and you can go in there on any given day and see how many cases there are in a state. And I just put the link to that CDC website in the chat for people. The other part of that question is monkeypox a hybrid of COVID-19? So Dr. Staci, you want to tackle that one?
Yeah, I can understand why someone would ask that question, because there's two there's two viruses that are kind of running rampant nearly the same time, one on the heels of the other. But no, they're actually very separate viruses. I know it seems unbelievable that we've got two viruses causing trouble at the same time, but actually they are. So coronavirus is its own type of virus. This is in a completely different family of viruses, and it's one that we've known about, since the 1950s, and had human cases in the 1970s, but it just hasn't really been doing this spread to human to human and until the recent years, and then now has gotten out of Africa. So no, not related.
All right, thank you for the clarification. We've had another question. If one person in a household is infected with monkeypox, how do other household members avoid becoming infected?
I could. Oh, you want to do that one?
Either way. Well, I'll be happy to answer that question. It's going to be I will admit that it is going to be a challenge, because what CDC has recommended is to isolate, to really keep that person who's infected, have monkeypox, in a very separate part of the household, and essentially kind of minimize as much as possible any potential contact with not just the person, but any of the environment. So they're really recommending like a room or 1 or 2 room with a private bathroom, and that any contact with any household members who may potentially have any contact will have to put on the appropriate, whether just have gloves on with masks on, and so if, let's say, bringing a tray, a meal tray, that they should, when they approach the side of the house with someone who's have monkeypox, they should have the mask on with the gloves on and such. And that after that encounter, that they should, wash their hands, and as well as wipe down any of the surfaces that may have been shared, as with the disinfectant wipes and such. So now it's certainly for those who can do that. That's not that is that's what CDC's recommended. Now the big challenge is those who depend on household members to take care of them, like children or elderly. That may be a lot more difficult, and that's something that the CDC hasn't really come out, and it's I think that's one of those things that having a discussion with the local public health nurse could devise a way to do this. Worst case scenario, and this has happened on some other parts of the world, the country, is that these patients get admitted, and we try not to do that, because that's also an infection risk for the other hospital patients. But the point being is that you'll probably, for those situations, you may have to kind of consult with the local public health nurse to kind of see what's the best way to kind of minimize the spread of monkeypox. Ultimately, they're probably, and this is something that may, depending on vaccine availability and such, is that any household members that potentially at risk may end up receive the vaccine to help again, the same way as instead of after exposure, this is pre-exposure prophylaxis to prevent them from picking up getting monkeypox.
Thank you. And Jace, some of us in our community are not fortunate to have enough to have stable housing, and we have some unhoused folks living in our neighborhoods. What are some options for unhoused persons in terms of quarantining and finding services?
Actually, no, that's a really good question, Eric. I know when things go on with COVID, the crisis center had stepped up and the community had stepped up with some low barrier shelter things. I think us working in outreach and prevention are just going to have the ability to work with our clients and give them options to be able to maintain a place that they can isolate-ish, having clean clothes. We talked about having clean clothes and clean bedding available. Not sharing anything that they have with their friends. I know with some of our population, it's pretty common to share clothing, sheets, and that kind of stuff because that's what they have. And if someone needs it, they're more than willing to lend theirs to them. But I think that's a really good question for us on the public health side to start talking about. If it gets to that point, what are our options? And working with other community members and organizations, like when COVID came about, and we were able to come up with something that will suffice to help with that population.
Great, thanks, Jace. Dr. Staci, we've had a question come in. Are there other risks or considerations for those that are HIV positive?
That's a really good question. And something that I'm very interested in as well. So, what we're seeing, so it really depends. That's the bottom line. It very much depends on whether your HIV is diagnosed and whether you are connected to care and on medication or not. Okay, and the reason that matters is that what we're seeing with patients who have HIV, who are on medication and have stable CD4 counts, they're having the same sort of presentation as the rest of the general public. And so I want any patients with HIV out there to, be very proud of themselves if they are connected to care and on their medications and doing really well, because that's actually one of the best things they can do to protect themselves, aside from possibly getting the vaccination, obviously. But if you are not aware of your HIV status, or if you know of your HIV status but are not connected to care, unfortunately, then you may be at risk of having more severe disease. And what we worry about is lesions, those pictures that Dr. Neal showed, of the discrete lesions. Well, when you have a high viral load and a low CD4 count, sometimes those lesions can become very confluent, like we saw in that poor gentleman's nose. And that's the sort of thing that we worry about. Also, the risk of being hospitalized and potentially of death, although I would say that we're not seeing much death, which is very good, goes up when your HIV is not controlled. We don't know that having HIV puts you at higher risk of getting monkeypox. That doesn't seem to be the case, although the CDC is looking into the data on that. And then there is also the flip side question of whether having monkeypox can put you at higher risk of getting HIV. That's something I actually worry about, because we do see that with HSV too, like herpes lesions, is that you are at a higher risk of acquiring HIV if you have active herpes lesions. We don't know that whether that's the case with monkeypox or not, but that is another issue that the CDC is looking into.